Taoiseach, it is no secret that children's disability services in this country are at breaking point. But the sheer scale of the problem is shocking when you learn that almost 800 vacancies exist in children's therapy services across the HSE's primary care services and children's disability network teams. Those 800 vacancies exist across physiotherapy, occupational therapy, speech and language therapy and psychology, with over 550 vacancies in the Children's Disability Network teams and over 440 vacancies in the primary care services, which means not alone are children enduring waiting lists for services, they are also facing inordinate waits for assessment. On your return to the office of Taoiseach, you told the Dáil, our vision is to make Ireland the best country in Europe to be a child. But unfortunately, the reality is that unless drastic action is taken, that statement simply won't apply to children with a disability. Just to give one example, John, who is non-verbal, has just completed junior infants, and in almost 5 months since he was diagnosed, not alone has he not received any form of service or speech therapy, his family haven't even been assigned a key contact and have been informed that the Children's Disability Network team assigned to him can, and I quote, only facilitate critical clinical needs as they arrive. Taoiseach, how can anyone stand over the situation like this? But it goes further, because on top of this we have an Eircode injustice. The service a child receives is not based on disability but on Eircode. While the number of therapy hours provided by the Children's Disability Network team covering South Roscommon increased by 55% in 2022, the number of such hours provided by the corresponding team for North Roscommon decreased by 26% in the same period, providing over 1,000 hours less than their counterpart. Taoiseach, we need to urgently look at the issues surrounding training, recruitment and retention, not just in terms of future needs, but also the needs of thousands of children today, which are currently deteriorating on waiting lists across this country. I accept that there are difficulties with recruitment, but that is why we need to take a more flexible approach in our recruitment and retention of therapists. Across the Children's Disability Network teams, almost 100 vacancies are unfilled because staff are on maternity leave, vacancies that didn't arise without significant notice. Yet it appears maternity leave cover remains unrecognised within our disability services and across our health services, unfunded. So it is not custom and practice to backfill these vacancies. Taoiseach, this has to stop.
Taoiseach to respond.
I just want to thank Deputy Naughton for raising this important issue, and I know it's one that we'd all be familiar with in our constituencies, from parents coming to us and telling us about the challenges they have in securing necessary assessments and necessary treatment for their children. And we are committed to finding and implementing real and tangible solutions to enhance services to properly meet the needs of children with additional and special needs in Ireland. As we all know, children with complex special needs access therapy services through the Children's Disability Networks teams, or CDNTs. There are enormous challenges in meeting demand for these services, and I know this affects children and their families very adversely. Waiting lists for services are being driven mainly by a shortage of suitably qualified therapy professionals to staff the CDNTs, the management of referrals, and also the slow uptake of new technologies. Funding for over 600 full-time additional posts has been provided by this government to enhance the capacity of CDNTs and to shorten waiting times. These additional posts are evidence of the government's commitment to prioritise intervention for children with complex needs, as well as those in special schools. A targeted recruitment campaign has been developed. It will be launched next week for the remainder of the vacant senior therapy grades within the CDNTs across the country. The HSE is seized of the importance of early engagement with the health and social care profession graduates coming out this year. So all of the class of 2023 have been offered the opportunity to apply for employment through national campaigns. Interviews have taken place and recruitment panels prepared. Permanent job offers will be issued prior to their professional registration. By the end of next year, the HSE has targeted the recruitment of 550 professionals for children's disability services. We expect them to be made up of graduates, 260, international recruitment, 111, and also a sponsorship programme, 182.
How about offering part-time contracts which may suit therapists who are currently taking career breaks, in many instances for family reasons? I've spoken to several therapists who would actively consider taking up employment for a set number of hours per week, including evenings and weekends, enabling them to maintain their skills. Evening and weekend appointments would also assist families where parents are working and result in fewer hours lost for children. Many of these services are located alongside GP out-of-hours services, so the buildings are already open. We are now seeing health services like endoscopy providing out-of-hours appointments. So why not do the same for children whose potential is being wasted on waiting lists today? By delivering services innovatively, we could make it easier to recruit therapists while also addressing the waiting lists and making a real difference to children like John.
Thanks, Deputy, for your suggestion. I'll certainly ask the CEO of the HSE and the Minister to examine that. Certainly, the Government has no principled objection to part-time contracts. We issue them all the time across the public service. It doesn't always result in a net increase in the number of people working for you, because once offered, some full-time people go part-time, so there can be gains and losses on that, but certainly something we're willing to consider. And also the use of out-of-hours buildings and facilities where there is space available. That makes sense to me, and I think a lot of parents would welcome the convenience of being able to take their kids to an appointment in the evening when they're finished their own work. So I think that's a good idea too. But I absolutely agree that the solution to a lot of these problems that we face with recruitment and retention in our health service and other areas of the public service and private sector is going to be innovation. It's simply the case that in the world whole, there are more vacancies for these skilled positions than there are people qualified to do them. And we have to embrace new technologies and new ways of doing things. And a lot of things are being developed, particularly online and virtual, that can make a huge difference. Mightn't be appropriate for a first consultation, but for repeat consultations and so on, can make a huge difference too.